This is R795 on dissertation proposal preparation, week 6. And I've scheduled this week in an important time for all of you because you're going to meet with me next week to discuss your dissertation proposals one-on-one. And I think it's real important to hear from people in the human subjects area before you meet with me, because you might have questions for me next week related to what Adam's going to be presenting on. After Adam presents, we'll take a short break and come back and talk to an IST alum by the name of Dr. Michael Thomas, who is a musician, is a language person, is an IST person, is a jiu-jitsu person, is a muddy run person. I ran the Chicago Marathon with him 20 years ago next month. He's a Renaissance person, if you haven't figured that out by now. And if it's a short discussion with Michael, then after that, I might present some more of my dissertation proposal or publishing writing tips. But probably we will not get to that until 2 weeks from now. But anyways, the agenda is rich tonight and with important people, and we probably shouldn't delay too much longer. So I'm going to throw it over to Adam and have Adam explain kind of the ins and outs of the IRB process and the history of it, as well as some of the challenges or stumbling blocks that people encounter along the way and how to overcome them, as well as maybe letting us know about where to go to find the forms and what you need to do along the way to have a successful dissertation proposal and dissertation defense after that, as well as other research that you might do in parallel to your dissertation or after you finish your dissertation. It is often the case that students will do a dissertation and collect extra data along the way. And what are the approval process that you need to do for that? And what happens when you work at an institution that requires a second IRB at them, which a lot of you are facing, or a lot of my students are facing during the past few months. I've had 7 dissertation defenses last spring. I had 7 proposal defenses this summer. I had 1 dissertation defense this summer. So I've had 8 so far, and I'm counted 4. Now today I counted 5. I will have, I think, 13 in total dissertation defenses during this year, which, Adam, I think is close to being a record. It's probably not a record. 6 or 7 of which were my advisees. So I'm knee deep in the IRB process with all of them. And so I will be listening intently if anything has changed from last year. So when you do talk about something that may have changed since last time you were here, do point that out. And so we've scheduled a break for around 7 p.m. If you go a little over, it's okay. If you go a little less, that's okay. You want to take it over, Adam?
Yeah, sure. So I can start. Just I'll briefly kind of say a little bit about myself. I've been with IU with the Human Subjects Office since 2011. Like most people, I had no idea what an IRB was, or that there was even sort of a review process. And I kind of got lucky and found a position and kind of was able to grow with the department. And I really enjoy what I do and kind of working with researchers and everything like that. So it's a lot of fun kind of seeing kind of submissions submitted and kind of how they develop and over time and everything like that. So yeah, that's just generally a little bit about me. I'll go ahead and start sharing my slides.
How many are in your office? How many people like you, Adam?
So we have, technically we have 2 offices that kind of function and serve 2 different audiences of researchers. So in the Bloomington office, there are 4 screeners and kind of like I don't want to say, I need to really praise this person. They're retiring soon, and we couldn't get anything done without Sharon Moran. If you've ever had any trouble and you had to call kind of like the Human Subjects Office, the general
right.
talk with Sharon. And to us, she's a saint. She's the most patient person and most helpful, resourceful person. So 5, including her. But basically 4 screeners that kind of review different departments and kind of different studies and things like that. And then we have and so we basically cater to social and behavioral research. For our Indy office, they're primarily working with biomedical research. So, research with like medical devices, FDA regulated drugs and things like that. So, but so they're working with kind of like the medical field and that kind of type of research there.
But if you're a student in Indianapolis and you're not in the medical field, it would get reviewed by Bloomington, right?
Correct. Yes. Sure. Yeah. Even if you're IU Northwest, IU Kokomo, if you're doing social and behavioral research, or that would all kind of come through our office. So theoretically, it's one office, but we kind of cater, social and behavioral research versus biomedical research.
Okay. Thanks.
Okay. So I'm going to go ahead and share.
And we'll get these slides later up in Dropbox, because Adam will send them to me.
Sure. Yes.
I have last year's, and there's probably not much that changed, but I want to get the most current ones.
Yeah. I think for the most part, I think everything should be the same. And thumbs up. Can everybody see the PowerPoint? Cool. Perfect. So basically, brief agenda. I'll try to keep this under an hour, definitely under an hour, so we have time for questions and things like that. I'll talk about the brief history, kind of why there are research regulations and kind of like the need for that. I'll talk about the role of the Institutional Review Board, or the IRB, the mysterious group of people that kind of give final approval for the study. The Human Subjects Office, that's where I work, and we're kind of the administrative body that helps researchers get their studies approved and kind of prepared for the IRB to review. So we're kind of like the middle person for that. I'll talk about different levels of review and kind of if IRB review is required. Spoiler alert, if you're doing something for a dissertation or a thesis and you're at IU and your research involves people, you will need approval. I'll talk briefly about the IRB process and workflow, kind of generally what to expect when you're submitting, and kind of timelines and things like that.
So Adam, you're in presenter mode. You might want to hit the switch to go in full screen of the slides.
Let's see. I don't know if that did that.
No.
Let me try something different here.
I mean, it works. It's okay.
Yeah.
Sunmei is my assistant. She's the tech person in the room. Sunmei, you have a suggestion?
Usually just the bottom side, just the icon, maybe just to change the view.
There you go.
Is that working?
Yeah.
Okay, perfect. So I think I shared the screen and not the PowerPoint itself. So, and I don't know, this might be a new feature, but I'm getting like a talk to text thing at the bottom. Okay. Let me back up just to make sure we're.
Yeah, a lot of these talk to text things are new. And so a lot of my students during the Zoom will ask that the text, so they might be from another country, they can see the text as well as hear it.
Yeah, I definitely can see some benefits to that. It got me by a surprise. I was like, am I getting a message? Okay. So why are there regulations? Until 1974, there were no research regulations or any sort of kind of ethical review process for research being done in the United States. So most often people were doing research for the sake of science. They had what they thought might have been the best intentions to get good data for research. Now, what the problem was is that really impacted the participants in the study. Depending on the study, that could have been, kind of minimal risk to very severe risk, death, things like that. And so I always, kind of talk about I kind of reference these three studies, the Stanford prison study. Essentially, if you don't know about this, this was the goal, or the general goal of this study was trying to see why there was conflict between prisoners and prison guards. And so what they did is had a bunch of people who had no experience with prison life pretend that they were either a prisoner or a prison guard. There was lots of verbal and physical abuse that was being done. It was almost like hazing that was being done. And these kids were locked into a basement, basically. I always kind of joke and call this one LARPing gone wrong, because they were pretending to be something that they were not without any experience with. Ultimately, this study got shut down for kind of basically the unethical practice. With research regulations, one of the things we want to make sure that human subjects are not harmed, and that's physical or mental, and that's kind of they were being harmed in this study in that sense.
So Adam, we're still seeing the first slide. So at least I am. So if you click on the bottom, I
click
think
the presentation
Click
view.
on start. No,
Yeah.
click on from beginning. That should do it.
Level 100 Pokemon.
there's a joke, Adam. What happens when we get 6 instructional technologists in a room?
Yeah.
They'll all tell you a different button exists.
Do you see the
Start to
from
bottom.
beginning? Because that's where you have to start the slideshow is the
Yeah.
problem.
No.
Yeah,
That's
yeah.
because he didn't enter the presentation view right now. So just to start to the bottom icon, the last one, the bottom, just to.
And yeah, on the bottom, the last
Yeah.
icon on the right-hand side.
Yeah. Right. Yeah, that one. Just click.
The
Yeah.
little cup
Little
holder.
cup or monitor, something.
Yeah, there you go.
Exactly. And then you can see, actually there is an icon swap display. So just try it. And then we can see, actually there is 2 views. One is presenter, the other one is for, just viewer. So you can swap the display. Does it start?
So yeah, I'm not seeing. I think is this the little icon you're talking about?
Yeah, just click.
So I clicked that, and it's
Yeah.
and then resume slideshow. I think I want to do.
Oh, yeah.
And then, so is that good? Do you see the 3 different studies?
No,
Huh.
No.
we're still on the first one.
I think it's whatever screen he is sharing, it's the wrong screen that's being shared.
Ah,
Yeah.
That was one more time. So
Yeah.
sometimes in Zoom, it's really unclear which screen to share actually, or which.
Yes, it is. Yes, it is. It's really stupid.
Yeah.
all right. So now you see the presenter mode with the kind of column on the side.
Yeah.
Okay.
just-
So I want to
Yeah.
click on.
Yeah. Try.
Looks like it's already clicked here. Try it again.
No, nothing.
The other thing you could do, you can send me the slides real quick and I can load them, but
Let's try. Yeah. So the looks like the little icon is already clicked.
yeah.
And so yeah, start.
Maybe click the from the beginning or just maybe
Yeah.
best way is to exit the document and then open it one more time. Usually, yeah, programmer restart.
I'm gonna try option
Yeah,
2.
sorry. Yeah,
Here we go.
that's a start.
So that's not sharing what I want, but if I do slideshow from the beginning, now do you see that?
No.
No, we don't see anything. We got you. We see you
Okay.
and us.
So we go back to, I think here we go. Try this one.
Yeah.
Okay.
Yeah.
That's it. Okay, maybe we
Alright.
got it. Yeah.
Yeah.
Okay.
And then just to click the icon the right side and swap a display. Maybe display setting something. It's a little bit different.
He's got it good. It's good enough. Because we see one slide ahead, and that's okay. That's
Yeah. Okay. Yeah. I'm not sure if that's haven't had that issue before. So you do see the images of the studies in reference, right?
yeah, we see them and the next part of the next slide. So
Well,
yeah.
so that's the spoilers for the next slide. So
Yeah,
you
yeah,
get
yeah.
a sneak peek of what's happening.
Right. So we're okay.
Yeah. Stanley Milgram study. He was a social psychologist. He kind of wanted to study, the role of authority and kind of why do people follow any sort of rules. He had a study that essentially involved participants coming to a lab. And what they were kind of generally told was that they're going to interview somebody who's going to be in a different room. And basically they would ask a series of questions. There was yes or no, kind of different ones. If the participant in the other room got a question wrong, they were supposed to kind of shock them. Now, they were told by the experimenter to increase the level of electricity as the experiment went on. The thing that they didn't know was that there was nobody there was somebody in the other room. However, they were also a researcher and they were not getting hurt or electrocuted in any way. Even they were, you know, as the study would go on, they would get, you know, these questions and they would get it wrong and they would hear screaming and then silence. And so to these subjects, they thought that they might have killed somebody, and they were never even told that they were that there was nobody actually being harmed. So even, you know, there was no physical harm to subjects or anything like that happening in these studies, but there was deception in the research, and there was really no debriefing process to let them know that everything was okay, no one was really hurt, but we, you know, we're testing obedience. Kind of, you know, we wanted to see how far would somebody go listening to like an authority figure. The Tuskegee syphilis study, this primarily was one of the main studies that really pushed the regulation wheels in motion to kind of the need for kind of review requirements was the Tuskegee syphilis study. Essentially how this study started, it wasn't really a study, but it was a public health service. Kind of in the 1930s, they would have, they wanted to kind of help stop or treat as best they could, you know, syphilis. This was before there's any kind of cure. They kind of selected a target, I don't want to go into too much detail, or a target population in Alabama. The Tuskegee Institute was in Alabama, so they said we could partner with them. This can be kind of like our home base. We can get rural farmers in the area to kind of come and you know, be participants of the study. They were receiving, you know, treatment and aid and things like that. Kind of where things turned south is part of the study is that they lost funding, and so essentially what they kept doing was still telling people that they were treating them for syphilis. But they weren't. They were basically kind of documenting the course of the disease and kind of basically untreating patients. And so they were, you know, kind of going to do these interventions. Some things as, you know, invasives of getting spinal taps to get spinal fluid, which were very painful. And, you know, they just were kind of, you know, thinking of authority. They were thinking, this is what we're supposed to do. This is a doctor. They know, you know, more than I do. You know, so they're going through that. There are so many unethical issues with this study, not only with, you know, malpractice, you know, they were kind of, you know, not treating patients and telling them that, you know, not even telling them that they could kind of leave or anything like that. And even in some cases when penicillin became available, they were trying to blacklist their patients to go even get treatment. So it's very, you know, very bizarre and kind of, you know, wild. You know, how the turn from basically essentially they were trying, you know, treatment, lost funding, and then essentially they were like, well, let's just keep this thing going, you know, as long as we can. Some unethical conduct here. There was a lack of informed consent. And so in human subjects research, one of the main things that we want to make sure is that subjects are fully informed about the research. There was, you know, not only were they not informed about kind of the things that were happening, they didn't even know that they can stop seeing those doctors and kind of seek health advice elsewhere. There's a failure to treat, just again, outside of research. You know, that's kind of, you know, a very, you know, ethical concern to not, you know, treat your patients. They wanted these people to get, you know, keep having syphilis and just kind of document the course of the disease there. Part of the research was deception. When these people were kind of enrolling into the program and things like that, they said they wanted to study bad blood, which is not a thing, doesn't exist. That was just a very kind of generic term that was often thrown around there. So there was lots of public outcry. There was lots of whistleblowers that were trying to get this program shut down. And I think even to the extent that they were saying, I think that what really got them to stop was that they said that they can receive kind of financial, I think, problems if they kept going through the study, like they can get sued. So they're like, well, we don't want that to happen. So that, you know, they're just kind of worried about themselves there. But yeah, so the study was shut down. There was lots of public outcry from this, and basically, you know, this kind of really put the wheels in motion for there to be research regulation. So from, you know, largely due to that, in 1974, the National Research Act was signed into law. This is basically where we get our Department of Health and Human Services. This is where kind of our core research regulations come from, and kind of, I guess, why we have research regulations there. One important thing to kind of point out that I always like to mention is that in addition to the regulations, that's very strict, and kind of it says who can review a study and kind of what an IRB committee should be made up of, and kind of different levels and categories of review. That's all kind of in the National Research Act there. But kind of one of the core concepts, ethics in research, wasn't really included in the National Research Act. So there was also a national commission with biomedical researchers, social behavioral researchers, non-scientists, that wanted to come up with kind of ethical guidance. And so one important document of literature relevant to human subject research is the Belmont Report. This is something that if you haven't, there's some training you do, you will be reading the Belmont Report. And so there's the main takeaway from that is that there's 3 ethical principles that should be incorporated and kind of, with the research at all times. Briefly, I'll just go over these. Respect for persons. This is the principle that individuals should be treated as autonomous agents. And so basically what that's saying is that you have full, or, as someone with autonomy, you're the decision maker there. So you have all of the information, we're thinking informed consent. Somebody with autonomy has their full capacity to kind of be informed and agree or not agree to the research. Tuskegee syphilis study, there was no respect for persons. They weren't fully informed about the research, or even that they can leave or receive treatment from other hospitals or things like that. Kind of a side part to this is that persons with diminished autonomy are entitled to more protection. So somebody who might not have the full or kind of a full cognitive ability to understand the information might have to have some sort of legally authorized representative. Or if you're thinking of in a legal sense with children or minors in research, there's diminished autonomy. So if you have if you want children in research, you kind of want to have, or you'll have to have a parent or guardian consent before the child can agree to be in the research there. So there's that part. So making sure that there's some sort of advocate for the actual subject in the study. Beneficence. This is the principle that human subjects should not be harmed. So again, with research, we want to make sure that subjects are safe. They're the reason why we get our data. We have to give all the thanks to them for donating their time or whatever to give data. So we want to make sure that human subjects are not harmed. And with that, we want to make sure that the benefits of research outweigh the risks there. So kind of there has to be a good risk benefit ratio. So with research, and if you're thinking of social and behavioral research, if you take a survey, there's going to be little to no benefit, almost always no benefit for you to complete a survey. But there has to be some sort of benefit to science and society. So if you're kind of thinking of just a scenario where you might get just as survey data, but the information there, it can place the subject at legal or financial risk or something like that. If there's no kind of benefit that outweighs those risks, then ethically the IRB could not approve that type of research. So we want to make sure that subjects are safe and that there is either direct benefit to subjects or benefits to science and society. So if there are no direct benefits there, so that's kind of one of the second principle. And then the third principle is justice. And for that the benefits and risks of research must be distributed fairly. The Tuskegee syphilis study, as an example, the participants in that, if I didn't mention that earlier, were all African-American males. And so anyone can get syphilis. But these participants were taking all of the risk in the research. They were being untreated, ultimately dying from syphilis for being untreated. And so there was no justice there. So these are the 3 core principles that kind of have to be with research. We want to make sure that subjects are fully informed, they have full autonomy, that they can agree, and stop research at any time. So they can just say, what, I don't feel like doing this anymore. And that's you say, sure, that's great. That's you. They have full autonomy. They shouldn't be harmed, and we want to make sure that the benefits in the research are outweighing any sort of risks that may be presented to them. And then thirdly, we want to make sure that if you are doing research, you're not kind of placing a certain group with all the risk while others benefit from that. And so those are kind of like the ethics that aren't really in the research regulations, but have to be part of there. And that's kind of for the IRB, that's something that they're considering as part of their as part of their review criteria.
So before you go to the next slide, for people who just came, Adam Mills from our Office of Human Subjects in Bloomington is walking through what it requires in terms of doing research and all the things you have to consider. So I want to welcome people here, and there'll be more coming later. And after Adam, we'll be talking to Michael Thomas about qualitative research. And so I see Karen's come here from the University of Houston. Welcome, Karen. Glad to have you with us again. And I also want to point out that when you were talking about Milgram's study on the shocking, there is one benefit to being online students and taking quals online, because in the old days, you would take them face to face and you'd hear the person getting shocked during quals in the other room yelling, "Oh, oh, oh." No, just kidding. I'm just kidding. They're not. Now you don't hear anybody, you're taking them by yourself, but yeah, so this is all in, there's an exam called the CITI exam. Mm-hmm. And so what happens if you haven't taken the CITI exam, this is important information in prepping you for that.
Correct. Yeah. So that the Belmont report, you'll read it, and then basically you'll be asked questions about the those ethical requirements there. I might have to apologize. I think one of my dogs might wake up. My wife just got home, and so you might hear a little bit of extra dog noise coming from Molly here. That's we have these regulations. Institutions that essentially receive federal grant money, whether it's a university or a hospital or some sort of institution, they have to have a human research protection program. So IU, we're a research institution. We have we do receive federal grant money. So if you're doing research that involves human subjects, whether it's direct or access to private identifiable information, there is a review process, and kind of you have to go through that. As part of the human research protection program, we kind of have two pillars. The human subjects office, we're the ones doing the administrative support, and we're giving guidance to the researchers and helping the logistics with the IRB members, so the committee meetings and things like that, and preparing the studies for them to review. So yeah, I'll kind of jump past a couple slides since we had a couple technical issues. So the core thing to kind of understand is that as part of the goal or objective is to make sure that human subjects are safe and that we're documenting research adequately. So when you have a research plan, we want to make sure that it's submitted and that it's just kind of all the information, all the procedures, all the your plan to obtain subjects, to inform them, all of that has to kind of be adequately documented. And so that is essentially the review process. Is you're filling out a proposal, explaining the purpose of your research, what the procedures are, the criteria for your subjects, and things like that. The Human Subjects Office, we're going to kind of review that and kind of ask some questions, clarifying questions, and making sure everything's clear and concise, and then we'll send it to an IRB member, and then they're ultimately going to give that final approval for the research. So we're all part of the Human Research Protection Program, but we kind of do different functions there. Just briefly about an IRB, since they're the mysterious group of people. They're an administrative body at an institution. Essentially, they have to have varying expertise with the type of research that's being done. Earlier, I mentioned that we have, our Bloomington office, we do lots of social and behavioral research, and our, the India office, they do lots of biomedical research. So we also have multiple different IRB committees, and so essentially, we're not the IU IRB is not going to see a study that involves surgery because they're social and behavioral researchers. They have no experience or expertise and really can't even weigh in on kind of the safety to a subject. And so that's part of the, part of the requirements is that you do have to have adequate education and training to kind of review the type of research that's being done for the proposal. So yeah, so that's generally, you know, the IRB, it's made of scientists, non-scientists, lots of faculty members, staff at IU. There are members in the Human Subjects Office that are also IRB members. There's people in the Department of Education, you know, various different departments. We have I think, you know, with social and behavioral research, we do have a little bit of crossover with biomedical research sometimes. And we do have a nurse who is also an IRB member. If you're doing research with prisoners, we have a prison rep who kind of gives guidance to, you know, the rest of the IRB committee if there's research with prisoners, because you know, there's somebody who's kind of letting them know about, you know, if the proposed research is something that would make sense in a prison and things like that. So there's, you know, qualified people to kind of review those studies. And ultimately the IRB, they are kind of reviewing, or they're giving final approval on research. So, you know, we go through the Human Subjects Office, we make sure you get all your documents and everything like that submitted. Then we send it to the IRB, and then they're going to give their final review. So hopefully, usually the goal, it's not always the case, but when we send a study to the IRB, the overall goal is to make sure that they don't really have any questions and that they could say, yes, this research is, you know, meets the criteria for approval. There's adequate provisions for subject safety. You know, the information is proposed to be presented in a manner that's understandable to the participants and things like that. So the IRB, they're approving things before research is initiated. So that's a very, very important aspect. You never want to do research before you have approval. So part of the process is to make sure that subjects are safe. So if you do the research, you might put the cart in front of the horse there, and that you know, you could, you know, essentially place the subject at risk. That would also be non-compliance, and that's something that you generally want to avoid. Non-compliance is basically doing any research that in a manner that's not approved. And so sometimes there's things in research that happen where, you know, you might be non-compliant, but that's, you know, okay, we work with that to make sure that, you know, the right steps are taken after that. The IRB, they can suspend or terminate research. So if there was something being done unethical, they can essentially shut the research down and kind of stop that, or, you know, any future research being done until things are kind of rectified or something like that. So that's very rare. You know, I think now we have a culture where researchers are thinking about the safety of subjects, and you know, so that's something that we don't often see, but that is something in their role and authority that they can do. So yeah, so that's you know, generally speaking, kind of the two administrative bodies. We have the Human Subjects Office and the IRB. We're all part of the Human Research Protection Program. So when do the regulations apply? So if you're doing research at IU and it involves human subjects, generally speaking, you want to think, I might be in human subjects territory, I might need approval to do the research that I want to do. So this is our fun equation. There's two things that require IRB review. It has to be research, and this is research by the federal definition, which is a systematic investigation that's designed to contribute to generalizable knowledge. The second part, that's the kicker there that kind of pushes it over the edge. If I ask everyone here to do a survey to rate, you know, my presentation or kind of give an evaluation, that's research. You might have the same 10 questions I ask everybody and send it in anonymously. That's, you know, that's research there. But the goal or intent is not for generalizable knowledge. We're not going to publish that information into a scholarly journal on my presentation skills. So that's something that kind of would push that over to the human research regulations. It also has to involve a human subject. That's the important part. So this is research about a living individual through direct interaction or intervention, or through private identifiable information. So if you're dealing with identifiable information, like a secondary data set. So if you're, you know, in education and you're looking at educational records, past test scores, kind of trends in a school or a department to see kind of where students are, you know, growing, or, you know, they're kind of educational data. Even though that you're not directly interacting with them or physically interacting with any subject, you would be getting private identifiable information. And so you would still want to, they would still be, a human subject in that context. So if you have both of those, research and human subjects, IRB review is required. So yeah, so this is just a general definition, kind of what I said about research. There's the research that we all understand, and then the caveat there is that there's an extra step is that you want to present and publish your finding in some way. And so lots of people ask, if it's for my dissertation or for my thesis, it's just going to a committee, nothing's going to happen there. Really, you are contributing to a scientific body of knowledge for that. And so you're kind of expanding the wealth of information for an institution and things like that. So it is a very important contribution to have, a thesis or dissertation published and things like that. So that is kind of part of the core concept there, is that is generalizable knowledge for that work you're doing. Human subjects.
But can I just add that even if you don't plan to publish it in a journal,
Yes.
dissertations are published in Dissertations International or wherever, and people will read it and people will use it
Definitely.
to expand the knowledge of the field.
Yeah.
And so that's what Adam's getting at there. This might not be in the most prominent journal in the world, but doesn't matter. In any study in any format that's provided on a to the world on a website, in an abstract format, even just it will be read. It will be, and that's the other thing I want to have you make sure that you're writing readable prose. So they're going to be read by people, and you want to have the best document that you possibly can have out there.
Yeah.
Go ahead. Adam.
Second part, human subjects. That's the easy part to kind of get down. You have to have direct interaction or intervention with a living individual. This could be physically if you have interviewing somebody, or if you're doing a survey online. Even if there's no physical interaction, that would by definition still be an interaction. You're kind of casting your net there to try to get data from living participants. And then I guess the weird one, or I guess the concept is if you're getting secondary data. So even hypothetically, if you want to look at publicly available Twitter posts. Things like that would be considered, you likely would have identifiable information. Not always, there's some people that have, a general kind of a Scooby-Doo picture for their profile picture, and their name is, Scooby-Doo man or something, generic. So you don't have, any identifiable information, but, with social media, there's lots of things that can link back to an individual. Emails, things like that you wouldn't expect. So if you're getting secondary data from a source like Twitter, Facebook, something like that, that would still be considered identifiable information, and you would want to get approval for that. So it has to be a living individual. So if you're doing any sort of retroactive research or for data that was collected 100 years ago or more, likely you're not going to have a living individual, so you wouldn't need approval for that. So we have essentially 3 different levels of review. Not all research has to be reviewed at the same level. Essentially, there's exempt review. This is minimal risk research. It's not exempt because you don't have to do it. It's exempt from federal regulation. And so essentially, the main difference, if your research qualifies for exemption, it doesn't have to be reviewed and approved by an IRB member. The Human Subjects Office, we review and approve that. So most institutions, if research qualifies for exemption, there's still a review process to make sure that the research is exempt. You'd be kind of shocked to kind of see how many, I would say even a month, we would see studies submitted as exempt that go full board, that needs to be seen by the full committee. And it could be something as benign as, the study submitted and, they, in the proposal, they just say they're doing a survey. It's going to last 30 minutes. Sure, that's fine, a 30-minute survey with adults. And then we're reading the consent form and it's saying after the MRI, we're like, wait a minute, that's not a part of, that's definitely not eligible for exemption. So, there's, we see lots of kind of studies like that too. But yeah, so there's 8 different categories. I guess, and by categories, it just kind of types of research methods that you would be doing that could fit for that in an exempt review. Expedited review, this is research that's still minimal risk, but this is where kind of the federal regulations kick in. So this is where an IRB member would go through. It's not necessarily by expedited, it's not necessary. That doesn't mean it's going to be quicker. It just means that it only has to be reviewed by one IRB member to give that final approval. So it's not going to the full committee. So basically what they want to do is determine that the research is minimal risk and it meets the criteria for approval. And that's kind of generally speaking their job to do. A full board study, this is something that where the research is greater than minimal risk, that the anticipation or magnitude of harm is likely going to be increased more than what somebody would experience through routine daily life or common medical practice. So if you're, it's very easy to be kind of identify medically if you're doing kind of getting bone marrow samples or getting having somebody test a new medical drug or a medical device. Likely that's more than minimal risk because we don't know the causes that can have to the subject. So that's something that the full committee would review and kind of make sure that the subjects are safe. So it's kind of generally speaking, from exempt, expedited to full board, there's just kind of it's just an increase slightly of risk to think of it that way. Even though exempt and expedited are still minimal risk categories, there's there's some things that might push those over to the edge to be require IRB review. And so kind of at a glance for examples of exempt research, exempt category 1 is for common educational practice in a common educational setting. This is kind of one of my, for me, one of the most fascinating kind of categories of review, because this is the only one, the level of review that it's very exclusive to the purpose of the research. So the purpose of the research has to be studying common educational practice. And it also requires it to be in a common educational setting, which that can have some kind of lots of flexibility. But as far as research, to be exempt or qualify for exemption, you have to basically, the goal or purpose is to study the effectiveness of a teaching method or kind of a teaching practice. And it has to be in an educational setting. That part can be a little bit twisted. If you're doing surfing lessons, you can have an ocean, and that could be your common educational setting for that type of research. So if you're teaching surfing lessons, and if you wanted to study the effectiveness of that, the ocean would be a great educational setting for that. So this one, a couple of also interesting things with that. Generally speaking, with exempt research, if you are doing any exempt research, ideally subjects would be 18 years of age or older. For exempt category 1, that is not the case. You can have minors in there. So if you're doing preschool or K through 12, you can have basically children in research in that category. So, but it has to be very, very exclusive to kind of research on education. Another example: educational tests, surveys, interviews, focus groups, observation of public observation. Those are examples of exempt research. We kind of call that testing, talking, watching. So if you're doing kind of like having somebody do a language test or an aptitude test and a survey, and then you want to interview them, all of that can be eligible for exemption, but they do have to be 18 years of age or older. And generally speaking, they wouldn't be placed at risk for doing that. A newer kind of categories, we have a benign behavioral intervention. So if you look at the Stanley Milgram study, I wouldn't say this would be, I don't think this would fully meet the exemption, but that's an example where you had somebody come to a lab and they were responding to stimuli and kind of doing an action based on that response. That would be a benign behavioral intervention. And as long as it's minimal risk, and benign is the key part there, that's something that can be eligible for exemption. And with this, subjects would also have to be 18 years of age or older. Secondary analysis of identifiable data. So if you're doing research without subject interaction, there's no intervention, but you're looking at, say, secondary records, voter registration records. That's publicly available information. It's identifiable. If you're doing research and collecting that as data, that could be exempt. It's publicly available data, and anyone can access that, and that's something that can qualify for exemption. Expedited review, for the most part, the majority of those categories are very specific to biomedical research. So anything that can kind of be done in like a routine, hospital visit. So if you go in and you get your height, your weight, your blood pressure, if they draw blood, saliva samples, hair and fingernail clippings, things like that, if you're getting collecting that from subjects for analysis, would likely fit in that expedited category of review. For social and behavioral research, we would still have, surveys, interviews, focus groups, interventions, things like that, but maybe they might involve minors. So you might have children in research. So this is something that would kind of going back to autonomy. If you have children in research, there's diminished autonomy. They're not a legal age of consent. So you'd have to have parent or guardian consent. So now we have federal regulations that we have to make sure that we're in compliance with. And so that's research. Making sure we have parent and guardian consent. Both exempt and expedited research, both minimal risk. Just the main difference is exempt research, the Human Subjects Office reviews and approves. Expedited, it goes to an IRB member after it goes through the review process. Full board research, this is where we get into experimental drugs and devices, invasive medical procedures. If you're doing research with children, research with prisoners, most likely that's going to go full board and require full review. And for social and behavioral research, it's kind of hard to kind of push over that limit to more than minimal risk. So you might be working with populations where the stimuli or intervention you're doing can place them at physical or psychological kind of stress that might push that over more than minimal risk. Kind of an easy example is, right, not really easy, but if you have somebody do exercise research, well, that's fine. Generally speaking, if they're doing moderate exercise, it's probably minimal risk. But if you have somebody going above, and it has to be monitored above, kind of like their heart. If you're raising their heart rate so much, that is more than minimal risk, because generally speaking, you're not, as kind of a resting heart rate or something like that, you're not placing anyone at risk. But if you increase somebody's heart rate, chances are that there could be more than minimal risk. And then that would have to go kind of be sent to the full board or something like that.
So Adam,
Yeah.
what's the difference between interviews of children, minors, which is expedited, and studies involving children, that is full?
So that one would be more kind of on the purpose of the research. So if you're doing, say if you were interviewing kind of minors about extracurricular activities and kind of things that they do, very innocuous questions or something like that.
Which is a current study I've got in Nepal, however. We're interviewing them on their study behaviors outside of class, taking these online courses during the pandemic. Pretty innocuous as a whole, but yeah.
So something like that would be, expedited. If you have children in research and maybe you're getting into things that might be sensitive in nature or something like that, especially if it's something
like alcohol and drugs and that kind of stuff.
Exactly, yeah. Something like that may potentially require full board review. And so that's kind of a good example. If you do like a college life survey or something like that, and generally, speaking, you might have somebody who could be 18, 19 or 20, and you're asking questions about alcohol consumption. That alone, they're minors in research. Well, it's hypothetically not if you had somebody who's 17, in college or something like that, hypothetically they're a minor. But I don't think that would change the fact 17, 18 or 19, it's still illegal, but that's not something that would require full board review. This would be something that risk threshold that the IRB kind of has to determine is that if it's more than minimal risk, if it would place them in their daily life at that's what they would have to kind of disguise there. So yeah, more so what I was thinking of what's an example? Children who suffer from depression or anxiety, if you're doing kind of research that induces that stress or anxiety or depression, that could be something that's more than minimal risk that would go through there. And so if it involved children, that would likely be full board. And that's a very hard, because there's minimal and then there's more than minimal. So that threshold is kind of a hard kind of thing and, challenging thing I would say for IRBs to kind of get down to, push over to that threshold. But I would always say if you ever have questions, what level of review, that's something you can refer to our website or even contact us to say, here's what I'm thinking. Where do you think this would apply? Like what should I apply for, an exempt, expedited, or full board study? That's something that you can always reach out to us for, in the human subjects office, and we can kind of point you in the right direction for that. I will say that we used to send a lot more studies to the full board who would then determine it as minimal risk. I think we were a little bit more conservative on kind of the types of social and behavioral research that we would send. So
Yeah, I think you were.
yeah, so there's a lot more kind of things that we do exempt or expedited with. So.
And how long does a typical process take for one, if Ben or, if one of my other students submits to this, how long does it typically take to get a response? And then how long on average do these things take to review? Does it take a couple times and they have to revise? What's typical?
Yeah, so generally speaking, in my experience, for like I'll do all three: exempt, expedited, and full board. For an exempt study, generally speaking, this can be like 1 to 2 weeks to get approval. Say if you submitted a study today, Friday, or today's not Friday. I feel like it's Friday. I'm going on vacation soon, so I think I'm in vacation mode. Today, Tuesday, usually by like within a week, that'll get its initial review, and then it kind of sent back. And usually with exempt research, the things that we're looking for are kind of, you might be missing a document, might be missing city training, clarifications. Usually it doesn't take that much to do, because with exempt research, it's you're doing a survey, an interview, a focus group. You might have somebody come to a lab and do something kind of brief, like a brief experiment or something like that. So they're not that complex of a study. So usually that would be like 1 to 2 weeks to get approval, and going through that review process. An expedited study, it's kind of similar. It's still, there's a little bit more information. Now we have the federal regulations kicking in, and in addition to going through that pre-review, then we're sending it to an IRB member who could have questions or something like that. They might want to see some revisions as well. So this, I would always say it takes about 1 to 3 weeks to get approval. And that's just kind of like a general average. And then it could be more or less depending on the severity of the revision. So I've seen exempt studies where they had like tons of different types of data collection methods, different data collection groups. So there's lots of, we need, X, Y, and Z for, teachers. And you also mentioned interviewing principals. What are the interview questions for the principals? How are you going to recruit them? How are you going to consent them? Things like that. And then so we kind of have to do it's almost like several mini studies in one study. And so sometimes those studies can take a little bit longer. A full board study, since this is where the risks are kicking in, and there's a lot more regulations, a lot more, instead of having 1 to 2 people look at a study, you're having upwards of 10, maybe even 12 people looking at a study. And their main goal, again, is one, making sure that this study is documented well and that subjects are safe. And so that studies like those, an IRB committee, they're meeting once a month. And so hypothetically, if you submit a study, today, your study might not be seen until a month from today. And if revisions are needed, that it has to go back to the full board committee, it would have to be revised and sent back in enough time to be sent back to the following one. So this could be something that's 1 to 2 months. And if there's a lot of revisions needed, maybe 1 to 3 months to get approval. So those ones are definitely time wise a lot harder to get, but the severity of risks the subjects are very much more increased, and so that's why it takes a little bit more time. But yeah, so generally speaking, exempt or expedited, 1 to 2 weeks for exempt, 1 to 3 weeks for an expedited study. And then there's plus or minus there too for, it could be a very, very, you might have a 5-minute survey with children, that can, you skew the number a little bit, that can take like a week to get approval for, because there's not much to review there. But if you have like, several different subject groups and, lots of experimental procedures and different, regulatory considerations, it can add a lot of time there. So, yeah, so it kind of, it can be plus or minus there, but I would say the average is 1 to 2 weeks. My advice is always try to give yourself more time than what you would want to do. So knowing that it can take 1 to 2 weeks to get approval, that I wouldn't recommend submitting a study 1 to 2 weeks before you want to start your research, because again, we don't know that review process. Sometimes there might be things in the study that may raise questions that can take a little bit longer, and then you got a plane ticket to go, into the field site somewhere, and hypothetically, you would be non-compliant because you're not approved yet to begin your research, but you're in the site ready to go and just kind of waiting on the sidelines there. So I always recommend, if you want to do research in December, starting the process now wouldn't hurt you. You can get your study design developed, submitted. You can go through the review process, get approval, and then have more than enough time to kind of, if you have to make changes, you can make changes and things like that before you even go in the field site there. So, yeah. And so, the main thing you want to submit your proposal. Another thing you have to do is kind of what I like to call showing your work there. Anything that's going to be shared with or seen by a participant should also be submitted for review. Generally speaking, I like to see 3 different things. Recruitment. That's the first step of notifying your subjects about your research. So this could be done through a flyer. If you have emails that you're going to send or somebody's going to send on your behalf, or you're going to walk up to people and say, hey, I'm doing a research about this topic. Would you be interested? So that very first contact, the very kind of first part where, a potential subject seeing material and information for the research, we'd want to have that submitted for a review. And that's something when you design your study, you would want to make sure that your recruitment process is clear. So if you just want to post flyers and have people click on a link or scan a QR code and kind of go to a survey or something like that, that you'd want to describe that and kind of submit a copy of that for review. The second part, after recruitment, so you I don't fish, but I'm using like a fishing reference. You cast that line out, and then you get somebody's interest. Then you kind of want to think about the consent process. So it's not getting a signature is not getting that's not the main goal. The main goal is going way back to autonomy in the beginning. We want to make sure subjects are fully informed, and so we want to know how are they going to get all the information that they need to know about the study. Most often we have study information sheets or consent forms, or if you're using children, assent templates that provide lots of information that can be reviewed with subjects that they can take home and have time to consider to be in the study. And then ultimately you'd want to go over that form and say, so given this information, would you like to participate? Do you have any questions? And, that's kind of, that it's part of the process. Oftentimes we would want to see consent materials that are given to subjects that provide them the information so they do have autonomy. The third thing is data collection instruments. So you recruited, you've consented, and now we're collecting data. So anything that's like a survey, interview guide, if you're doing tests, if you're kind of doing lessons, and you kind of have examples of assignments and things like that for students that they're working on, we would want anything that's going to be used to collect data to be submitted as well. So generally speaking, those are like the 3 main things I like to see with a submission: is recruitment material, consent material, and data collection instruments. If you're doing surveys, if you're doing surveys, we'd expect to see like a final draft of the survey, because that's something that's everyone's going to see. It's a standard template that's going to be passed out. For interviews or focus groups, we recommend like 5 to 10 questions. Interviews are organic, and you might ask a question, and then a participant might say something, and you want to say, oh, can you elaborate on that? And kind of, start asking questions that are kind of a little bit off script. That's absolutely okay. We don't expect you to know what those questions are, and you absolutely do not have to submit those for review. But we want to see the core questions that you plan to ask the participants. any sample stimuli we would expect to see submitted for review. We had a really interesting, fun study. I always like to refer to it. And generally speaking, they wanted to see if watching cat videos on YouTube helped with reduce stress and anxiety. And so we had a study that had people take a survey as like a pre-test, then they would watch cat videos, and then they would take a post-test, and then they're rating their levels of stress. So as part of the review process, we had people submit sample videos of cats playing with yarn and, kind of things like that. So that's, sample stimuli that subjects were reviewing that was also submitted for review. So we had on our quality protocols where all the studies were submitted, there's a study that has a bunch of cat videos as data collection instruments. So yeah, I always think that's pretty funny.
It's really funny if the cats were required to sign the human subjects form.
Yeah, yeah. That's where you'd want to get into IACUC. They do all the animal research.
So we're at 7 o'clock, just to let
Sure.
you know, we're a couple minutes past. So
Okay.
I want to get to Q&A. So you're about at the end of this?
Yeah,
now?
this is basically, generally what I kind of, and this is like a very streamlined process of what it looks like. You're going to submit a study. It's going to go through an intake process where they make sure that there's, the city training and conflict of interest, things like that. All the prerequisites are ready. If it is or isn't, they'll notify you and let you know that, who needs to complete what. Then it's going to go through a staff review. Whether it's exempt, expedited, or full board, you work with a screener, somebody like me who reviews the study. If it's expedited or full board, once things are looking complete and consistent, we send it to the IRB. They give their review, ideally, hopefully approval at that point. If not, they might have questions where it will be sent back again. And then it goes through outtake, which is essentially outtake is approval, and that's where you can begin your research. I'll send the slides and kind of jump past this, just kind of where to submit and things like that. If you are a graduate student, I would say this is kind of something to keep in mind, is that you would have to have a faculty member or advisor listed as a principal investigator. This is an IU policy. Essentially, they want somebody who's, tenured or kind of invested in the university. So, if you're a grad student or even at myself, I couldn't be PI for a study. They'd want like a faculty member or advisor listed kind of to assume responsibility and oversight of the research. Even if you are designing it and you're running the show, collecting the data, doing all the analysis, you'd have to have a principal investigator there. So yeah, we'll go to questions from there.
Why don't you go back a slide or so, just to make sure we hit some key points here. Before that, one more. There, the city exam. Yeah.
Oh, yeah,
so
city training.
yeah, the passing score rate of 80%. I thought
Yeah.
that was kind of interesting.
Yeah.
So go. You want to talk a little bit about that before we go to Q&A?
Sure. Yeah. So city training, this is required for all researchers, principal investigators, the co-PIs, everybody. If you're engaged in research, you're required to complete city training. This is not a test to see if you can do research, but it's more of a kind of a tutorial to kind of cover the Belmont report, which I mentioned earlier, research ethics. Even if you're not doing medical research, you're going to read about HIPAA and private health and privacy information and things like that. And then you'll read information. It's a test and tutorial, and so you'll read and then take answer some questions. There's 2 to 6 questions per topic. There's 11 different topics. You do need, as it says, 80% to pass. Hypothetically, like the HIPAA one, we don't deal with medical information a lot. So if you get a 0 or 50%, you can retake that module and kind of bump that up. So it's not like it's, if you get something below that, you're not excluded to do research, but it's something that you'd have to get, a total of 80% or above in order for it to be complete. I do have to update this. Once it is complete, it's active for 5 years.
Oh, hey, that's good news. Oh, my.
And so yeah, so it kind of goes out of
Just
sight,
made
out of
my
mind.
day. Really,
Yeah.
you did. I thought this next summer I'm going to take it. And now not for 2 more years. Okay.
Yeah. What else is there? Oh yeah, so the city side, it's done. It's not through. It's you can sign in with your IU username and passphrase. It will link that data to our quality protocols. So if you are doing it, when you are completing it, you want to make sure that you sign in using your IU username and passphrase. So that way it links that information. So if you did like a Gmail or something like that, we could do a manual search, but it wouldn't link to the system. What else is there? Yeah, and so that's the key thing. That's kind of a, this is something, if you really sat down and kind of read everything and did all the tests, it can take about 2 hours. There's a lot of content that you have to cover. You can start and stop at any time. It's not something that you have to do in 2 hours. Like you can do one module a day if you wanted to, if you had the time for that. So that's all up to you.
Okay, I didn't know you could start and stop.
Yeah, yeah.
So we should probably go to questions soon, May.
Actually, I have a question. So actually, as for the city tested, the first time I was confused. That's because I have, the basic city, certificate. So I thought that was for them, but actually that one is different, a little bit advanced one. So maybe you have to, address that one. That's because maybe other students will experience.
Yeah, so
it.
they're so part of City is they have lots of different trainings and tests that you can do, from human subject research to animal research to tons of different tests. And so there's basically 2 educational tracks. There's the social behavioral researcher stage 1, and then there's the biomedical researcher stage 1. So if you're just taking it, stage 1 is that's the first one, and then stage 2 and 3 would be 5 years from now, and if you're doing research you can retake that. But there are options for responsible conduct for research or a basic course or something like that. There's when you're filling things out, there's an option for IRB members, and so people say, oh, IRB, I must have to take that. So that's not the case. So there's that one very specific social behavioral researcher. That's the one you want to take. Anything that says basic course or responsible conduct of research or IRB members, anything like that, you do not have to do. And so when you go to the city site and you're kind of filling in the information for what test you want to take, essentially for social and behavioral research, I think the first box might be the social behavioral researcher stage 1. Anything else you can say no, not at this time, and just skip and go through that. But because there are other tests that you can take, but they're not required. So there is one specific requirement that you have to do, and that's one of those things too, where it's like, okay, I did it, I'm fine, and you submit your study and you get an email or a notification that it's not complete. So it just it might be the wrong course that was taken. So
yeah, and then actually I have 2 more questions. The first
Sure.
one is how long is the IRB approval valid after getting approval?
So essentially indefinitely. So for an exempt research, if you get a study approved, and we have studies that are approved in like the 80s that are still ongoing, until you close the study, that it's open. If you're a student and you leave the university, there's no longer oversight over the study at that point. So if you did it for your dissertation and then you left and you at a new institution, you would no longer have IU's approval to continue collecting research. And yeah, so for exempt expedited, it's indefinite. Research that's full board, where it goes to the full committee, those do get renewed every year. And so those studies are more likely to have like a, they can go as long as you want them to, but you have to renew every year. Exempt and expedited study, once you're approved, it's open indefinitely until you notify us that it's done, or until you leave the university.
You mean that anyway, just it takes 1 more year, it's okay?
Yep.
I don't
Yeah.
Really?
Yeah.
Okay.
Yeah.
Okay, that's good. And then one more thing is actually the first time I submitted the IRB at the time, I said that just, one time I will perform the online survey, for example, but later I changed my mind. It's, maybe 2 times it would be better. At that time, do I need to submit again or update or nothing? So I don't know.
So you're saying you would want to go from one survey to doing 2 different surveys?
No, actually the same survey, but just 2 times, the before
Okay.
just the end of the survey, but right now it's, for example, just the middle or the
Like
later.
a pre and a post.
Yeah.
Yeah.
But exact same survey, true.
Yeah, so that's a good question. So if you're doing a study and you submitted one survey, but then you say, now I want to do beginning and end of semester survey, you can do an amendment to update your study to indicate that there's, you want to do that survey twice. And so that's something you can do there. You don't have to submit a separate study. You can just update the original one to go from one survey to two. And then you can update your materials, like your consent and recruitment, to say there'd be two surveys, one at the beginning of, one at one point, one at another point, whatever duration of time that would be through the middle. And yeah, so you could update the study that way.
So update the IRB, but still collecting data is okay, right?
Yeah, so you
I
can
don't need to
so
wait
if you're that initial one, you
Okay.
can still do that. And then
Okay.
if you want that second survey, you'd want to wait till you get approval for that. So if you're, if you asked me to do a survey and I did it, but then you want to take me a second survey, but you're not approved to, you'd want to make sure you get approval first and say, then before you reached out to ask me to do a second survey.
Okay.
Yeah.
Thank you. Yeah, that's good.
Other questions? Who's got a question on the Jam board, wants to ask one of those? Go ahead, just jump in now. This is your chance.
Maybe it's a really good chance,
Rachel?
I think. Yeah, it's
Rachel?
a really good chance.
Sorry, I have a question about indemnification. And maybe this is off topic, but does IRB indemnify the researcher or the institution or both? Or
Sorry, what was the question?
does going through the IRB process indemnify the people involved, like the researcher and the institution?
So you can't be sued?
Right.
Yeah, good question. So hypothetically, if you did research without approval, and somebody complained and tried to sue you, that's something that they can take legal action in. If you have a study that goes through the IRB and through the review process, you do have legal counsel that would kind of defend you in that process. So yeah, there is that's, I guess a benefit of going through the approval process is, and people try to sue for anything. So, going through that, you would have IU's legal counsel that would kind of represent you for that research. So that's not saying that you can do whatever you want at that point. So, this would be the context of, hypothetically, if somebody complained that they didn't get payment for research or something like that, or something, so you would have like the backing of, the university for that.
Okay, Shannon turned on her camera. Shannon.
I have a question, please. If I have someone who is going to help me with the quantitative data analysis and I give them the data set that is completely de-identified, does that person need to be listed as a key person on IRB, or do they not need to be listed since it's de-identified?
Not at all. So if you're just having them do data analysis for you and they're strictly dealing with anonymous de-identified data, they would not be considered engaged in research, and they would not have to be listed, or they wouldn't need city training or anything like that. Hypothetically, you can give any anonymous de-identified data to anyone without approval or anything like that. So.
Okay, cool. Thank you.
And we had that recently in a study. So we recruited people to help us analyze data that got to be overwhelming, and we needed some better eyeballs on it. So yeah, and hands and pens and pencils, all that.
I always love seeing, sometimes I'll see a study submitted, they're doing audio recorded interviews, and they'll say, they'll transcribe the interviews within 1 week. And I'm like, that's very ambitious. A lot can happen with a week. And, even though that seems like a lot of time, you might need a lot more. You wouldn't allow yourself a lot more time to kind of go through that process too, because, transcribing and coding everything, you might need access to those audio recordings for a little bit longer than you would expect. So
what's happening now is that it's automatic translation with the Kaltura system and Zoom, but it has to be cleaned up.
Yeah.
There's a lot of cleaning up that happens. And once my students who are on the study are done, they want some help analyzing, they make it anonymous, then they need some help in actually analyzing what's there. They've spent so much time cleaning up, they're exhausted. They're kind of exhausted with getting the transcripts. Karen's had her camera not on, but you have your audio is unmuted. You have a question, Karen?
Yeah, my question was really about, and I don't know if, let me see if I can put the camera, if it will come on. Yeah, it does. Okay. My question is about the refresher courses in City.
Mm-hmm.
So I don't know if there's a time limit for the refresher course. I took the basic course, and like you said, I don't need to take it for 5 years.
Mhm.
But then I think it was about year 2 or year 3. Year 3, actually, a refresher course came up.
Mhm.
Do I have to take that refresher course, and do I have a time limit where I need to take that before I can continue?
Yeah. So if you're, with the old timeline, if you get a notification that a refresher course is needed, if you're actively doing research, I would say it's a good time to do it. There's no one that's really going to check, or you're not. There's not a kind of a negative consequence if you don't do it. And the only time you would notice is until you submit a new study. If you're added to a new study, then that's when we would say, okay, this is expired. We need you to update that study. So hypothetically, say if you got your study approved, you did your city training, and you're doing research and your city expired, and you haven't submitted a new study, there's no one. You can still continue to do that research, and it's, hypothetically you should update that city, but it's not like there's no negative consequence for you to do the research that you were approved to, if that makes sense. So there's not like we don't really have like aside from that notification that you have to do a refresher, there's nothing extra that we do to like, oh, you didn't have city, so now it doesn't count. Your research is nullified now. So that's like a minor thing that you wouldn't have to worry about. So really, that's only checked for new studies. If you're being added to an existing study or studies that get renewals, then we'll say, we'll kind of check those at those times. But yeah, there's no like sense of urgency. So that's something that should be updated, but can be kind of put on the back burner.
Okay.
Yeah.
Yes, thank you so much.
The thing about a basketball player who's been traded, he doesn't have to have he or she doesn't have to have a physical while he or she's on the team, but they've traded to a new team. They have to run through a physical.
Yeah.
So just like starting a new study, you have to update. Yeah. If you've expired and all that. Yeah. Anyone else have a question? We've got, I think you, yeah, go ahead.
Yeah, I have a question regarding if the research involves participants outside of IU, do I need to get IRB approval from other institutions, or IU is sufficient?
And that is very contextual to another institution's policy. So if you get approval at IU and then you want to collect data from, say, the University of Kentucky, if their policy is that any researcher who's collecting data from students or staff from the University of Kentucky, that they have to get approval, you might have to. So that's something you might have to reach out to. Most often, you might not. That might not be the case. Like if the wheels were turned, say if somebody from the University of Kentucky wanted to collect data from students at IU, as long as they're getting appropriate permission from the course instructor or somebody at IU, to that kind of a contact person. But sure, yeah, I'll pass their survey along. We don't require any sort of external approval from somebody doing it that way. So most often that is the case. If you're doing research, going through, if you went through a different university, especially if you were maybe if you're doing like not a study abroad, but what's the I'm trying to think of the when you go to a new institution, kind of under advisement. I'm forgetting the word there. But basically, if you have some affiliation with another institution, you might have to get approval from.
If you're a visiting scholar, sometimes.
Visiting scholar, thank you. I was like, what is that word? Also, sometimes it is the case where you might be staff at the University of Kentucky, but you're a student at IU and you're doing research. You might have to get approval from both institutions to do, depending on the type of research that you're doing there.
That's happening now. A couple of my students, one's at University of Illinois Springfield. She has to have approval there as well as at IU. Another one was at a community college in Florida. She had to have approval there as well as IU. And you was at St. Xavier in Chicago, on the south side of Chicago. So you have to find out what their policies are. And then, some of the smaller schools tend to say IU is pretty rigorous and that's fine, but you don't count on it until you check it out. Let's take two more questions. Then we have Dr. Michael Thomas is here. So who hasn't asked a question yet? Ben, and maybe Megan, haven't you, either one of you have a question?
No question for me. This was very helpful, though. Thank you.
Okay, Ben.
Yeah, same here. I'm just, taking it all in.
A lot to
Thank-
consider. Yeah, I always say that's like the tip of the iceberg for compliance. The presentation. There's lots of lots of more information that's out there and kind of things to consider. But yeah, so hopefully, you have enough kind of information to know where to start and kind of contact if you have questions and things like that. So.
Anyone else have a final comment or question? If not, I want to thank Adam for coming in for the third time to one of my class 795 class. And I am going to stop the recording at this point. Great job. Thank you very much, Adam.